everyone, it's Alex Savidge from KTVU, Fox 2 News here in the San Francisco Bay Area, and we want to talk about some of the latest headlines surrounding the coronavirus outbreak. And to do that, we bring in Dr. Vanila Singh, who is a clinical professor at Stanford School of Medicine and former chief medical officer at the Department of Health and Human Services. Dr. Singh, always great to have you on.
Always great to be on. Thank you, Alex.
All right, we are reaching an important time period in this country right now. The word from federal officials is that they are, in terms of the vaccine rollout, we are expecting that by the end of this week, half of all adults here in the U.S. will have received at least one dose of a vaccine. But at the same time, we are also seeing cases beginning to spike once again. They're up about 10% or so nationwide compared to last week. So there is concern about the potential for another surge. But how do you define this sort of moment that we're in right now in terms of trying to get enough people protected with the vaccine?
Yeah, so Alex, this is a really interesting time. I like to call it the semi-vulnerable stage we're in, where we've got the good news, we've got the vaccines, which are the miracle unto themselves, and we've got several of them. We know that Moderna, Pfizer, and Johnson & Johnson, though we've seen the hiccups with Johnson & Johnson, but the truth is that it's a great vaccine. Those are supply logistical issues. The problem right now is we're also seeing the variants in the United States, and these variants are mutations in that COVID SARS virus. And that always presents a challenge in that the vaccines are protective for the most part in the matter of hospitalizations and death. That's important, and that's the bottom line. However, it doesn't mean that you won't necessarily be exposed to those variants, and they're easily transmissible. And so they certainly are playing a role in the surge that we're seeing across the nation. And so it definitely gives us pause, and we know how we're managing this. We're still getting medical therapeutics out there. We're still working on getting people vaccinated. And so the fight really doesn't stop. This only reemphasizes that we're in the middle of this, and we cannot let up.
A lot of people, as you know, are keeping a very close eye right now on the state of Michigan. And there's just a lot of concern there about the rate of increase of COVID cases, of hospitalizations, of deaths in that state. And it's interesting because they're actually doing a pretty good job of getting people vaccinated there. But at the same time, they're still seeing, what would appear to be a surge beginning to build there in that state. I wonder if we can make any sense of what's going on.
Yeah, so this has been really interesting. I mean, just like you mentioned, Michigan's vaccination rates are on par with other states, including California. However, the state is really experiencing what the worst surges in the nation. They have seen more hospitalizations, huge numbers of new cases, and it's really similar to what they saw in their last peak, which was around November. So it's a very similar peak. And the real question is why. Many people have noted that the strain or the variant that is out there is the UKB117 variant, which we know is more transmissible and may in fact be more deadly in some ways. So that is something that I think will be tracked. We know that there are other variants around the nation, but it is important to note that other companies such as Moderna and Pfizer are considering booster shots for these variants. And so the question will be, will that be enough to ward off such a surge? And it only highlights the importance of the ongoing vaccination efforts in Michigan. It also highlights a very important point that we've seen throughout the last year, which is young people who know that they are safe, generally speaking, in terms of clinical outcomes from the COVID disease, who are out and about. It's, people have been likely cooped up in cold winters and are going there, and they really need to get vaccinated. That's going to be a very essential part of including and expanding the criteria that we see which is necessary to gain herd immunity.
Yeah, and it does sound like in many cases in Michigan and across the country, unvaccinated younger folks are tending to kind of drive up the cases that we're seeing. So, with that being said, we are about to see eligibility expand nationwide to any adult over the age of 16. It's going to happen. The same thing is going to happen. The expanded eligibility is going to happen here in California. Already has happened in many counties in the Bay Area as well, where you're seeing folks 16 and over eligible to get the shots. How big a difference do you think that makes? And the follow-up is, are we going to have enough supply once you expand to that wide pool of people? Are there going to be enough doses when folks show up?
So first and foremost, expanding the criteria is something I'm very supportive of. I think we are doing the right thing by opening up the gates. There's so many people who are motivated and really are qualified. And we know the clinical studies support the 16 and 17-year-olds, and that's really important for parents to know. The other thing is that the more people, again, who get the vaccination and have the immunity, the more both sides of the equation become comfortable for those who are vulnerable and those who aren't. And I think that's going to improve our ongoing, knock on wood, low daily average that we're seeing in California. So we definitely want to see that. As far as the supply goes, Johnson Johnson had some logistical issues. It did put a big monkey wrench, if you will, in terms of the supply getting out there. My understanding is a lot of those folks have been replaced. With the places have had replacements with the Moderna vaccine and others. So I think there is coordination going on. Fortunately, the government also has been ordering more and more of the vaccine in the millions. And so I think that puts us ahead. So while it's a glitch, it's a short-term glitch. I anticipate that it really shouldn't have too much effect in terms of folks wanting and being able to get their vaccinations.
Yeah, I mean, hopefully it's just a short-term issue because obviously there was that issue with a certain batch of vaccines that were Johnson and Johnson vaccines that were mixed at a certain facility. They couldn't be sent out, and then so you had to sort of get more of those doses back online to be delivered. So hopefully that happens soon enough, and there's enough supply once every adult is eligible to get a shot. Let's talk a little bit about some of these so-called breakthrough cases of COVID-19, and this is the rare occurrence really when someone who's been fully vaccinated against the coronavirus still winds up becoming infected. It does happen because as we continue to point out, these vaccines are not 100% effective. They are just pretty close to 100% effective. So there's a chance for these breakthrough cases. And I know you were looking at a study out of Israel that highlighted this. What did they find?
Yeah, so this is a big study that's got a lot of buzz on the internet. And the folks over at Tel Aviv University, the scientists there, had published the first of its kind real world study that looked at several hundred people, both who were vaccinated, partially vaccinated, and unvaccinated. And they took the positive cases and sequenced them. And they found an unexpected 8 cases of the South African variant in those who were fully vaccinated. Now, the important thing about this is that number one, it's not peer reviewed yet, and it's a small study. It needs more powering, but it's certainly meant to be shared because we know that there is a chance that folks who are fully vaccinated may have those strains. The upside in all this is that most of these people did not have symptoms. And so it might just mean that the increased transmissibility of these viruses might be there, but they're not necessarily going to take hold. We know the vaccinated folks, fully vaccinated folks who are, committed to the social distancing and mask wearing, etc., are really unlikely to have bad outcomes. And that's the bottom line. That's really what we're trying to prevent is a hospitalizations and mortality, and that still stands. So very interesting study, needs to be expanded, and I think we look forward to knowing more about these variants.
Yeah, but doesn't sound like cause for alarm by any stretch.
No, absolutely not. And that's the most important takeaway. This is science, it's information, it's more data, but it also speaks to the fact that in general, these vaccines are doing a tremendous job. and the numbers of efficacy, in prevention of bad outcomes, it's really outstanding. And so I certainly want people to feel very comfortable going out and getting vaccinated.
All right. Well, you just touched on this here. Why don't we end on this note? But the fact that just because folks are getting vaccinated, and a lot of people are, and it's fantastic, it doesn't mean we can let our guard down. You hear a lot of people say, "Well, I'm fully vaccinated. Why do I still have to wear a mask when I go to the store or go out in public?" What would you say to them?
What I'd say is this: you have done a huge job by mitigating the risk for yourself and those around you. And that's an important feat. We're still in the midst of understanding the variants. And, as we open up schools and businesses, we definitely want to keep that progress. And so I would just say being more cautious in this time where, again, we're in a semi vulnerable state. The population's getting vaccinated, but not everybody is. And there is the emergence of these variants, which up to now we know that we can likely handle, but we still want to make sure that we stay ahead of the game in this. So, being cautious along with all that we're doing only keeps us in the forward movement.
Yeah, yeah, it's certainly not easy, but we have to kind of stay the course as a society. It's difficult though, for sure. All right, good advice. Always appreciate your time and your insight, Dr. Vanila Singh, clinical professor at Stanford School of Medicine and former chief medical officer with the Department of Health and Human Services. Thank you for coming on. We'll talk soon.
Great to be here again. Thank you.
All right, take care.